name is Dawn Bird, and I'm doing a presentation today on innovative technology in healthcare and how it's saving time, money, and improving overall healthcare. So first I'd like to go over a diagram I made and in specifics to how you see this emerging healthcare coming about and why it's so much needed. So we have an increased life expectancy of the elderly adult. People are living longer, and why? Because of their lifestyle choices, whether it be healthy or not. And so in the result, we have chronic diseases. Encompassed with that, we've got increased financial costs of these burdens and lack of Medicare reimbursement. So they are not reimbursing for any hospital readministrations that could be otherwise prevented. We have the financial crisis, lack of health care team members. There's a crisis shortage. And patient involvement. There's really a lack of patient involvement and patient satisfaction. But with IT solutions that have come along, including the electronic medical record and telemedicine, that has improved patient satisfaction by 74% according to the CDC, as well as increased job security through technology, IT jobs. Nursing can also work in IT, and that has increased from 2001 to 2012 by 20%. So a definitely positive impact there. Also with advanced technology, we have RFID chips and upgraded medical devices, so that can really save time. In essence, that it cuts down on charting. Electronic medical health records can be embedded in these chips for tracking and or upgraded medical devices such as implanted or robotic surgeries. And another statistic I'd like to point out, here in Fort Collins, Colorado, Dr. Bender has stated that it has increased his patient interaction time from 64% to 67%, which is huge, he says. Other electronic medical record safety is a reduction in medication errors, which increases patient satisfaction and overall reduces adverse outcomes that could happen. And also implementing with keeping everybody in the loop on the health team, such as doctors and other doctors reducing duplicate tests or labs and saving money and overall patient satisfaction and really quality care, which is what you want in dealing with patients' lives. Telemedicine is great and upcoming in a lot of insurance companies. It really keeps the cohesiveness and also ups the best practice for the patient as policies and protocols really determine how they're treated, and then they can be treated from far away by phone, by computer. There are monitors at home now to send in records, vital signs, their blood glucose, any medication changes that might be needed for possibly congestive heart failure. All that can be sent in to the physician and changes made accordingly. So really just efficient overall. And I would like to ask now, are there any questions? Question number 1, what are the downsides of new technology or risks, if any? The answer, like anything, to err is human. Like paper charting, you can make a mistake with electronic charting, but there are red flags to try and prevent that, and if you make a mistake, you are able to correct it just like in paper charting. Also, another issue is computer crashes or natural disasters like hurricanes set off and power outages, disrupt any kind of technological devices, iPads used, and so forth. Question number 2, is there a shared vision in healthcare and devices? Yes, there is a shared vision. And by 2017, Medicare and Medicaid would like to see all facilities incorporate the electronic medical record in their practices. And also, there's an initiative and where you can share electronic medical health records and emergencies between U.S., Mexico, and Canada. So just really prevent a lot of emergent necessary means. And question 3, what are the consequences if there is a breach of security? According to the 2009 American Recovery Act, there are fines for breaking HIPAA laws. It's $100 per violation, and also could incur jail time. So there are very serious consequences to be had, which is very important in any kind of security with electronic health records. So in summary, I'd like to just say again that technology is going to become more advanced as we move on in the future with the ever-growing population. And I thank you for taking the time to listen.